Here we go. If people joining.
Yeah, we'll wait for a minute to make sure everyone is able to join us. If you're just joining, thank you so much. We will get started here in a minute.
You're getting over 80.
It's like popcorn.
Popcorn actually sounds really good right about now.
Too early in San Francisco.
It's 9:30 here in Phoenix, Arizona, and popcorn, I could do some popcorn. I'll wait on the glass of wine though, but I could do some.
Welcome, 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 welcome.
Yes. So I think the numbers are starting to slow down a little bit. So we can go ahead and get started. Thank you so much, everyone, for joining us today to talk about public intercompany LGBTQ panels, building lasting impacts from current conversations. This is going to be a really fun conversation covering something that we worked on for the past year as a cohesive production team, the main leaders on the call here today with you. And so this session is really going to start with a few introductions. We'll show you a teaser video, and then we will get into the actual meat of our presentation and explaining the origins and some key tips if you're interested in doing something similar. We will have plenty of time at the end of this call for some question and answer. So with that being said, let's get into a few introductions. I'll start. I'm Melissa Price, and I am a director of consumer intelligence and analytics with CVS Health. I'm also the national co-leader for the Pride Plus colleague resource group. I'm based here in Nashville, Tennessee, and my superpower, which we'll be sharing all of our superpowers, or just a selection of them. I'm a super connector. I connect big ideas and I connect people. So Shantae.
Hello, everyone. Day one summit, very, very exciting. My name, Shantae Rothschild. My pronouns she, her, and hers. I am coming to you this morning from Phoenix, Arizona. I also work for CVS Health. And with Melissa Price, we lead, from a national perspective, our Pride Plus colleague resource group. In my day job, I am the senior manager of the Federal Employee Program, where my team and I manage the pharmacy benefits for the federal government. Up next, we have our dream weaver, Andrea, and actually I forgot to mention my superpower. It is shape shifting. I love learning new things. I love seeing things from different perspectives because I believe with that perspective, that view from someone else's lens, we are able to grow and connect as humans. So with that, Andrea.
Beautiful, thank you, Shantae. Very hard act to follow. But I'll try my best. Andrea Carucci, based out of New York, Italian origins. I'm a senior manager in Accenture, and day job I work in everything commerce and everything around commerce, advertising, and new digital marketing tools. And beyond my regular job, what I do is to participate in everything we do for our colleagues and clients around the LGBTQ+ conversation with the Pride Network. One of the many superpower I have is this idea of dream things, make things, right? Thinking about new stuff and how to make that happen. And I'm very proud to say that this was one of the things we dreamed a few months ago and saw it live. It's kind of like a big moment for us. So last but not least, Christian.
Thanks, Andrea. Thanks, everybody, for joining. It's great to be here. Christian Winslow with Accenture. I'm in marketing and have been with the firm long time managing large C-level programs and marketing programs with our clients, including IND client marketing here in the US. So my superpower is sobriety, which is what saved me and why I'm here today. And so I'm a big believer in recovery and recovery messages and anything I can do to lead a healthy, happy life and help others as well. And a big part of this is what we're doing right now. And so I'm a huge believer in our partnership and what we've accomplished here, and excited to get this going. So over to you, Melissa.
So Andrea, I think you can queue up our teaser video.
Yep. 3, 2, 1, go.
LGBTQ plus healthcare equity is a priority for us at CVS Health, because not only is this community an important and integral part of who we are, it's one that's faced some real challenges in healthcare, whether it's about access, acceptance, or understanding. So we were looking for a partner that not only had deep expertise in healthcare, but also real credibility to help us educate, inform, support, inspire the community, and really, most importantly, have a forum for open and authentic communication to help us progress the idea of health equity forward.
As a sponsor of the employee resource group for our Pride community in Accenture, I'm personally extremely proud of the partnership that we have with CVS Health to bring health equity to life together as partners for our LGBTQ community. We've been partnering around subjects to address vaccination status for COVID, to look at transgender health equity, but also mental health and many more ideas that we have to bring to life together. And two organizations like CVS Health and Accenture can really make an impact for our community.
Really, the voice of the LGBTQ community has to be heard and amplified. It should be the framework of how we think and talk about it, but how do we take action to solve it?
When Black people talk to Black people and brown people talk to brown people and gay people talk to gay people, they're much more apt to learn and to believe the information, the education that they hear.
Don't let access be exclusive. You have this opportunity now to get this. Don't be part of the statistic and continue the disparity.
At CVS Health, we have made it very clear. We're trying to ensure that it's clear that when you go to seek, if you could get vaccinated, the first thing you see that is no cost, because we think that is critical.
I think what we do know today is that the benefits of getting the vaccine far outweigh the risk of getting COVID.
That's why we're all here. We're here to build some trust, demystify some misconceptions, put the focus on the equity of the healthcare of this important group of people.
If you've never used the pronoun they, them, for someone who is non-binary, and you are trying to do it for the first time, I'll tell you what, it's going to be a little, it's going to be a little rocky. We do need to actually kind of practice and say the words aloud.
Just remember that trans people are people and have healthcare needs, as everyone does.
You can't make decisions for this community if we're not at the table.
So whenever you tie that 60% of us are having difficulty finding a mental health clinician and 43 have been diagnosed with anxiety or depression, once again, just further exacerbating the issue to saying, hey, we've got to do a better job to connect members of our community to affirming and clinically competent providers who understand our needs and can provide that care and support that we're looking for.
You see all the, all the amazing people working on this. All right, let me take this back. Can you see my slides again, right?
Yes.
Yeah.
There we go. So, but by the way, I also see that some people are already writing in the chat. We Shant and the team will monitor the questions, so we make sure we can use, all the inputs we receive from there. But the idea, behind this series was really, what we were trying to describe in the video was how can we bring our collective knowledge and some our collective influence to answer some tough questions. And we will talk later with Kristen and Shante around the exact topic we covered. But in a moment of a global crisis, and as you can see here, the big question we're trying to answer was posed in August 2020. What we were trying to do is to connect the dots, right? And you use the power of CVS and Accenture to bring along all the other elements of the ecosystems that constitute health. So health ecosystem in narrow terms, but also the broader group of activists and NGO that are involved in everything care, and to make sure that we could answer some concrete questions, right? We will dig in how we got those questions, also involving some of the ERGs, and in order to make sure that we could try to help our people in the community, within the company, but also outside. What is also very interesting is that one of the objectives we set at the beginning was to say, we're not going to have probably all the answer to those questions, but we want to use this platform to create those answers. Kristen will touch on one of the topic we treated around COVID vaccination. And there were a lot of unanswered questions from the LGBTQ plus community that we were not even able ourselves to find. Melissa, is there anything else that I'm missing here in terms of like the kind of big dream, big goal we had when we got together for the first time in August?
Yeah, I would add that, as you think about healthcare, it is over 1/6 of the United States gross domestic product. It impacts everyone. If you don't have health, you don't have anything. And we also at the same time knew that disparities show up in all kinds of studies. For instance, we have been, you saw in the teaser, working with the Trevor Project, which is a new relationship for some of us in dealing with suicide prevention for LGBTQ plus youth. And as an example, in one of their studies, 2 in 5 LGBTQ plus youth seriously considered attempting suicide in the past year over the course of the pandemic. When you hear numbers like that, it pushes you toward action and toward the knowledge that there is a huge equity issue here that we need to address. And at the same time, both Accenture and CVS, we play in this healthcare ecosystem, one from a consulting thought management side, one being an ecosystem provider and player in different forms and fashions. But we don't, as Andrea, you said, we don't have all the answers. It is an incredibly complex system, and it serves a subject matter that's highly localized and highly individual. And across all of the different players in the ecosystem, where you're talking about doctors, insurers, hospitals, nonprofits, it is increasingly centered on patients, all patients, including the marginalized patients out there. If we want a system that works for LGBTQ plus people, we needed to have conversations, real, intentional conversations that collects the insights and perspectives and stories from all the components of the community so that everyone has an equal seat at the table. And so as we were thinking about components there, having that, leadership, industry leadership, and putting that to the side, being an answer facilitator, listening, and then putting the tools into place to mobilize anyone and everyone to bridge equity gaps were really, really important ideas to bring to the table in this big question.
Yeah, let's say that this was kind of like our big why, and we got together with Melissa and the team like more than a year ago, and we were trying to think, what is the best way to answer those questions, right? And what can we do in order to create some valuable content that can be easily shared, but also can be incorporated in the broader process of all the kind of work we do, right? So that's why we came up after a couple of brainstorming sessions with these ideas, right? They were kind of like the building blocks of the way we designed the workshop, the series, whatever you want to call it. But we always, this is where kind of our guiding principles around, okay, every time we talk with our, speakers, we want to make sure that we bring to life some real stories, right? Some real stories around healthcare and around how can you improve healthcare experience for the members of the community. On the side, we also thought that this can be not only like a one-off experiment, but we want to make sure that also this one, the reason why we recorded and we publicly published it, is we want to make sure that we can use this one as a learning asset for everyone involved in the, in the healthcare conversation. So, for example, CVS, of course, with all the 3,000 plus employees, but also on the Accenture side, we have a huge practice around healthcare and life science, and we want to make sure that these videos are seen because are a witness of what is true and what is felt in the community. And this video also were a learning experience for us because we've been exposed to things that we might have touched tangentially in past, but never had a direct experience. And finally, I think that when we were kind of working on creating the script and creating the interactions, we always end up asking ourselves, what are the actions we want people to start doing or doing right after watching the episodes, right? So we were always trying to make sure we could not only talk about a problem or talk about it like a general issue, but also we can suggest what is the best path of actions after the information has been shared. I think, Melissa, that the next one, it's kind of like it really sums up what we thought about it. Do you want to comment on this?
Yeah, this is really the big idea, but also underpinned by executives. One of the ground rules that we enter into in each of these conversations is we need to accept that we don't have all of the answers. And you can see that this came from Tammy Lewis, one of the chief marketing officers. So we had from the start executive support from the highest echelons of CVS Health. We had the same from the Accenture side. And this was coming from the moderator, framing the conversation, setting the tone for what we were going to enter into. And by doing so, we just found that the conversations became so much richer. And so as we go into a discussion about what some of those conversations have looked like thus far, keep in mind that these are people that were able to bring their passion into the conversation. They were able to not have to worry so much about the politics of saying things perhaps incorrectly or that maybe a company might disagree with. They were able to bring their expertise fully and completely to the table, knowing that we don't have all the answers and everything is on the table because we need to fix some issues that are really doing some damage across decades to the LGBTQ community. And so with that, Christian, Shante, we'll pass it over to you to take us through what these concepts look like and how they came into being.
Thank you, Andrea and Melissa. So with that, what we have done, Andrea shared that we've created a learning asset. And so with that is something that we hope that people will walk away with several things. One, seeing the information that is presented, seeing these industry leaders speak about real-time things that are affecting the LGBTQ plus community, knowing that we as Accenture and CVS Health employees the privilege that we have of working for such amazing organizations that are about being part of the active change and allowing us these platforms, allowing us to come together and create these learning assets. So with that, the privilege, knowing that a change, education, resources needed to be provided in the LGBT community. First, it was around COVID, right? At the time where there was a panic, there was some hesitation in the LGBTQ plus community. With that, we decided we needed to do something. Working for companies, again, with a platform, with a voice, we decided to come together and basically share information. Again, as Melissa shared, knowing that we don't know everything up front, but knowing that we had the connectors, the ability to bring together these resources to provide information to the community. Intersectionality was a huge focus as well. Generational issues. So working with partners such as HRC and SAGE, to name a few, again, bringing these leaders together to have a timely conversation about COVID, the vaccine, and hesitancy as it relates to the LGBTQ community. And with that, also providing, Andrea mentioned, action. So with that, providing tools. So a toolkit with resources that after the viewers watch these videos, then they would have research, articles to refer back to so that they, again, could take this information and share it with others. So that was something that was huge for us. We realized that providing it is great, but also allowing people to have action items and tools to reference was important as well. Christian, anything that you would add about our first session?
No, I mean, I would say that the thing that strikes me the most about what we've done is we've gone beyond, we always held ourselves kind of accountable to not having a normal corporate kind of roundtable, that we really pledged to go deep and dive really headstrong into these topics in ways you would not typically see on corporate sites. We deliberately, you can go back one slide. We deliberately did that. And so on the COVID one, for example, we asked questions and had the panelists address issues, especially back then when we first did this in March, where people didn't have all the answers on vaccines and the LGBTQ community because we weren't part of the studies. So we had to get some real answers from the specialists in terms of what is the effect of vaccines on HIV medications, what were the frontline reactions to getting vaccines, and we had an actual pharmacist from CVS relaying stories about how she has to individually bring people along on a journey because there's so much hesitancy around the topic. The thing that I relate to the most in my generation was that growing up under AIDS with so much effort that we had to make to get attention from the system. Now, fast forward, we have a vaccine, and there's a legacy of distrust in the community back then that we had to overcome, plus many other issues that come up. So tackling that head on and knowingly that we made a commitment to have that as our first topic because it was so top of mind, made a big difference. And I myself, I got to say, like Melissa was saying from the comment before about how we hold ourselves accountable to what we know, what we don't know as well. I learned things as well. So it was awesome to put together. Then the next topic was transgender. So Shante, want to get into that a bit, and then we can dive into more detail as well in the next slide, I guess.
Sure. So as Christian mentioned, our next topic, understanding transgender healthcare access and the patient experience. And so stepping back a little bit to the COVID-19 session, coming off of that, there was excitement of this went great, better than expected. We had our clients reaching out, we had community members, just so many wonderful responses. And the question of, well, what's next? How do you follow that? And so we came together to determine what we thought would be the next topic, because there's so many topics that we need to discuss Again, being members of the LGBTQ plus community, as well as knowing what our community needed as it related to discussions around healthcare. And so with that, we landed on transgender healthcare. And that conversation was quite lengthy, did a lot of research, again, started with the curious, starting at curious of knowing, here's what we know, here's what we don't know. How do we find the right individuals to come together to share this experience, to share knowledge, to share next steps? And with that, we wanted to share the full spectrum, everything that needed or that needs to be done to help both patients, both community members, as well as leaders and companies make decisions that are taking into consideration our transgender community. And so with that, again, gathering those leaders, those individuals that can speak to these topics, also doing research so that we could create that toolkit. So once that session had ended, the discussion didn't stop there. The toolkit, again, providing resources that prompted other conversations and connected individuals, again, highlighting what we don't know, what we can do immediately to make a change, and then outlining steps that would take the discussion further into the future for long-lasting impact.
It was really important for us to get real practitioners and experts on this topic. And it was important as well to continue the thread around health equity, which is the common denominator around all these topics, because you can go in so many different directions. And so we kept also to the premise that we needed to have frontline perspective. So we had someone who works in the local community center in Chicago and Howard Brown, as well as real practitioners and experts in transgender, as well as transgender activists. So I think that what resulted from that was an incredible amount of personal storytelling and a come together around a toolkit that for us at Accenture, we actually added that to our internal IND site because it went deeper on the topic than we have before, getting to real tactical answers to questions such as, how do you fill out the medical forms? What do you do when the doctor says this? How do I address this situation? It broke it down into very specific, concrete actions and scenarios with the resources for help. And that's why I love what we're doing in this area to make it real and authentic, like we always talk about.
And I think the various perspectives too, with our LGBTQ community, with all of the alphabets, we all realize that while we are a community, there are things that we don't know about each other. There are things that being, a queer woman of color, there are things that people ask me and I'm like, I don't know. So again, that admitting of we don't know everything, and then going out to find the experts who again, sometimes don't know, but being vulnerable enough to say, here's the question, let's find out together. Here are the barriers, let's discuss, let's come up with a plan that we can all apply that makes sense to everyone. So bringing the leaders, the decision makers together with those who are having the experiences, putting them in the same setting so that those action items are things that, to your point, actually make sense, that actually make a change. So I really enjoyed that about the discussions and about the recorded sessions.
The last topic was most recent one was mental health. We decided to focus on like the way forward in mental health and think about mental wellness. So we can go to the next slide, Andrea. And so what we prepared here on this next slide that you'll see is a detailed look at each of the topics and the speakers, and you'll see the representation. And this is meant for you to see in detail how we came to these content descriptions and focus, and how we decided on the mix of titles and experts that would fill in and route out these conversations. We have something real exciting coming up in January. You'll see just a headline, you'll see that the rotation we do is about every 3 months or so. we come to these sessions. And in some cases, we make a decision, like for the one on transgender, to release it in July, because so much is done during June for Pride that we wanted to have a little window spacing to have that in July for more visibility. So we make those kinds of decisions as well. For January, you'll see something that makes us really proud. We'll get into this later in the back and when we do a concluding slide. But it's a big picture look at health equity and the way forward. And some of the people we're bringing together on that is a real serious kind of commitment from very senior folks around what we're doing and their own personal interest in covering this topic as well. I think Shante, unless you have something else to add now.
I would just go back to the evolution. So from our first session to the most current one, how our lens evolved, how it widened and shrunk based on what we had learned and feedback. So from where we started to where we are now, we were able to adapt, make changes based on the topic for the most ideal outcome.
So what were the results and the impacts? Because these were broadcast on CVS YouTube platform, because we did external and internal promotion around this, we got a high degree of visibility in both numbers of views on YouTube as well as social media metrics. So our respective organizations work together on joint marketing plans and social media plans together with the partners we have and speakers we have in each of our programs to make this as widely viewed and shared as possible for CVS's part. Its entire spectrum of healthcare ecosystem partners, employees, and clients, which is the hugest compliment you can get from our side as well. Wide distribution internally and visibility on social media and from among our leaders. The amount of support and endorsement we received from our stakeholders, from leaders in our respective organizations, providing a regular cadence and being so disciplined about producing assets that can be used for learning and furthering the topic of health equity was really motivating for us. And I feel like over the course of the past year in producing these and creating these kinds of assets, we've really helped both our organizations kind of rally around these topics at very senior levels, and as well a commitment from our leadership to support what we're doing and also take a personal stake in it. Shante, you want to add anything, or anybody from our group?
No, I think you covered. Go ahead, Shante.
I was just going to say that the personal experience of Accenture and CVS, we are our partners outside of this. So just to be able to come together and learn and work with you has been amazing. Christian, Andrea, Melissa, and just the support of our companies. During our meetings, sometimes there's laughter, there's tears, just this awe of we're doing this. It's almost like giddy of being able to make such an impact with the power of our companies supporting us and seeing the need and how people are responding, just knowing that we are making a difference and connecting others and raising visibility for those who aren't a part of the LGBT community or allies or even had any idea. It's just, it feels great and encourages us to do more. So this is one of the reasons why we are so enthused to share this with you here today.
Yeah, and my only comment goes on, point number one. I think it was very, very interesting for us to have like a CMO, senior managing director, all the kind of leaders of our organization being involved, as Shante was saying, Christian mentioned at the beginning, people that usually are not in this conversation to raise their hand to be in it, right? Once we kind of frame what we want to do and how we want to do it, right? So, all of us, all the four of us, we are like mid-senior ranks of the organization, right? So our job was to really create the platform so that our leaders could be part of. And it never happened in my career, to see like a CMO discussing in a round table around implication of, vaccine and HIV positive like a treatment medication. Or I never been involved in a conversation where we discuss, misgendering pronouns for transgender patients with senior leaders of our organization. That thing was really, kind of like striking for me, because it really brought to life what it means when you build an asset platform, whatever you want to call it, to enable that conversation. And trust me, those conversations were not easy. I mean, they are not easy for us. For some of us in our community, imagine for those outside. So being able to have that kind of healthy discomfort, healthy learning curve, it was phenomenal. And it paid off. All the hours and nights we put to get this thing together and make it work. Any other comment, folks?
No, I think we can go on unless you want to add anything.
So let's go to the kind of thing. I think like the idea is to say, okay, this is what we've done, right? And now we want to kind of like tell you a bit of like the behind the scenes, how we made it happen, right? So, and I'll start, but probably this is like for everyone else also in this room, in this virtual room. As you can imagine, the kind of the complexity behind this was, of course, around really defining what we wanted to address, right? Okay, this idea of having we had a brainstorming session with this group and with some of our colleagues from the ERG groups to say, okay, what is the problem we want to address, right? What are the answers we want to bring to life, right? And of course, there's tons of logistic and coordination with then once we define those set of questions and topics, can we bring them to life, and also we can make them available for the broader amount of people ever, right? So I think that I can speak because I was very involved with that kind of like, okay, what are the teams we want to treat, and what are the ones that we decide not to discuss in this conversation, right? Melissa, Shante, Kristen, is there anything else that on your side, marketing, the coordination that you want to add on?
Yeah, I'll jump in. I was the one that led the show flow, and I'm not going to hit on all of these different points. You can read them for yourself, but this gives you a little bit of the concepts and inspiration of the planning aspect that needs to go be applied throughout this entire process. And if you're a project manager sort, you can think about this as a little bit of a form of a Gantt chart where there are things that overlap with each other. Every time we did this, we learned something new about the production. But for the show flow specifically, I had to think about it as kind of a form of a movie script or a screenplay or just a general guide to facilitate that journey through the discussion. And there were 4 primary components into these show flows. Number 1, we wanted to set those discussion rules. We talked about that earlier in the call. Number 2, the foundation, the background, the history of where we are and where we have been on a certain topic to help frame the rest of the discussion. The third one is the key topical points that we wanted to make sure that we dug very deeply into during the call. And then the final component, actions that you can take in your own local community, whether you are a provider or whether you are just a person who is a participant in this healthcare system. The other thing that was really, really important about the show flow was that moderator and speakers participated in this process. And so when we pitched an abstract to secure speakers, and while we did that, and while we also prepared a show flow, it wasn't the final version of that show flow. We had meetings with them to discuss because we wanted them to contribute into what questions should be asked, what points or subpoints need to be made, and how do we enable them to bring their true expertise, all of it, into the dialogue. The production result of that was, number one, people felt better prepared, and so they were more comfortable. Number two, we had strong chemistry and people were able to feed off of each other in those answers. And then number three, as they fed off of each other, the depth of insights just continued to expand. And so that recipe for crafting the show flow of the journey through that dialogue really became a holistic process that involved all the different parties and ultimately contributed to much richer and conversations that really left a good, strong impact in a lot of different ways.
The hardest part about this series, each one of these, is preparing the content, the talking points, honing it down, because there's so many things to talk about, and to really focus in on where we can have an impact, and by being really precise about it, because otherwise the conversation will just be too broad. And our whole intent about these series is that they're very intentional and go deep on something where you have a new insight that was super important to us. And the other thing I'd say is that Melissa's selling herself short. Every single time Melissa led the show flow and constructed that with the moderator and the speakers, everyone was extremely grateful for the support. They felt held, it felt organized, it felt like they could work within it and then provide what they knew, and that it was well constructed. So huge part of that was that skill and being able to do that. I'll pass along another tip, which is that early on, we decided that it was really effective to do a pre-recording first. So first to do a recording session, and then pass it by legal, or we'll go on some, I guess we're going into that now, and look at getting cuts from that to do social media in advance to promote it. And then fixing on a date 2 or 3 weeks later, usually, where we then broadcast it. So doing it pre-recorded also made it less anxiety-inducing, I'd say, for our speakers, and gave us the freedom also to create some space around social media and advanced promotions, and for communications as well. Are super important to get the word out, so we then could launch it.
Go ahead, Shanda.
I was just going to re-emphasize the importance of planning and not making assumptions. So you would think that the speakers who are leaders in their organizations or who have done many presentations, you would make many assumptions of they know this, they know that. To what Melissa and Christian were saying, having that show flow, that meeting, making sure that the participants are comfortable is important, because in reaching out to speakers, we had conversations about selecting the right individuals, but we also want to make sure that we support those, because it's a big deal. It's not easy to get in front of cameras and do a presentation that will be shared time and time again. We said at the beginning, many people, myself included, we don't have all the answers. So to be put in front as a leader, as an expert, it took a lot for those individuals. Of course, they were willing, but as the planning team, it is important to make sure that your participants know what is happening along the way, setting up those opportunities. What Melissa did in creating the show flow was excellent. We heard time and time again, I've done thousands of presentations and never have I felt this prepared. So that in itself was a great compliment for our team.
Yeah, one of the comments I was about to make is around the coordination. So, like, as you can see, after a year, we kind of like think the same. But the coordination also on the communication afterwards, and I think like Christian here was, master in navigating the machine of marketing. The idea of, this is like a new concept, a very, very hands-on conversation that usually you don't see in the usual corporate promotional messages, right? So having someone whose brain is focused on how can we make sure that whatever is the thing that we record, we can actually share it easily. And, of course, the legal, Kristen touched on a couple of things, but, also orchestrating, we had to talk to our marketing group, PR group, now government relationship. So that was as important, I think, as the actual act of creating the content. Because then, if you have an amazing content, but then you cannot publish it or you cannot go across, you can you have something not very useful. So also those three things of, planning, make speakers comfortable, and then very good coordination around also communicating. That was a major hit.
And before we go on to the next slide, we have a question around talking. So what were the conversations? How did we speak with upper management to get them on board for this? So would anyone like to start off on that?
Sure. So at least from our side at Accenture, our stakeholder is the global lead for our Pride network at Accenture, and someone who Andrea and I meet with on a regular basis when we talk about our programming, especially when we do programming with clients. And the broad topic of health equity, of course, made a lot of sense. And then each topic we introduced, there was no question these were relevant. And he suggested topics as well that we focus on, like mental health, which we all agreed made a lot of sense to do. So we got permission from the very get-go. The assumption was that we would go deep and vertical on topics that were really relevant, and we got a free hand to do this.
So I'll chime in also, and I see a funny comment. How it sounds like Melissa wasn't joking when she said connector was their superpower. So I personally am constantly looking at relationships. Who is connected to who is, hierarchically related to who in our systems. I'm mining LinkedIn. I'm looking for how can I bridge a relationship that I need through my network. And every time I dig into that, it opens up an additional avenue for me. So that's one thing that's really important. The second thing is, at least on the CVS side, Shante and I started the work even in advance of our partnership with Accenture here, in that we were trying to refocus our colleague resource group into a business resource group that provided tried and true return on investment. And we kept having those conversations over and over and over with executives. And so executives started to, give us a little chance in certain areas, and we got into bigger and bigger rooms. That transcended into the show flows. It's all about reading the room. As you saw, we had people who were vice presidents, chief officers, directors. These are executives, and we owe it to them to bring our best and make sure that they are prepared in topics that occasionally can be a little bit uncomfortable. And by doing so, that also continues to open up bigger and bigger stages for us.
Totally.
I think we should also say, it's kind of obvious, I guess, but I think someone should say it, that we're all active in our ERGs, and our ERGs were huge supporters of this and provided real valuable insights as we developed the topics and sharpened them a bit. So I do want to do a call out, and of course, we're huge network influencers in terms of getting the word out and offering up like people from the ERGs who are in specialty areas to help be part of our planning committees. So, you know, one of the things that I think we're really proud of at Accenture is that our ERG groups, our Pride Network in particular, our leadership, there's a lot of value seen in what we do, and the leadership the Pride Network has, and their ties to our senior leadership are very tight. And what I'm most proud about is that we're able to offer up a program as part of this Pride Network that is really valued. That means a lot to me.
And Kristen, the comment that I want to add here, okay, what if you don't have those kind of relationship, right? Well, it's also true that, for example, with some of the stakeholders we talked to, we never talked to before, but if we, you know, this was also a great excuse to bring them along, right? And we intentionally decided also to talk to people that were distant from our day, you know, everyday interactions, because if the kind of like the framing and the designing of the idea is done right, we didn't, nobody said no, basically, right? You know, the topic was so relevant and so cool and so consistent with the corporate messaging on solving a problem. This was not just another chat, you know, like another generic inclusion and diversity topic, because then you can conflict with the broader agenda, right? Now, this was like a very specific, narrow but broad conversation with an hands-on approach. So nobody even questioned every time we asked for something. It's like, oh, okay, of course, yeah, I want to be in, right? Even if we never talked to you, we never had the chance. So kind of like the kind of like hidden hint here is this can also be used to have access to people you usually don't have access to, right? Because it's so consistent with the overall mission of the companies, you know, most of the companies we are part of, that it's actually a good key to entering those doors that we usually don't have access to.
And again, that's where the planning comes into play. So if you're going to meet with these leaders, looking at the company's initiatives, maybe that leader's initiative, when you're going in for those conversations, be prepared, be succinct, have done your research. If the initiative for that leader or your company is ABC, tie what you're doing into that. To Melissa's point, return on investment. I am a member of organizations outside of CVS. Those organizations, we focus on other things, still impacting the community. When I am at work, I am also looking to impact the community, but through the lens of our business organization. So with that, I will say that was one thing that really helped us as well. What is in it for the organization, and how can we use those internal tools to help, you know, support our brand and get our company's initiatives and message even further out there, which is helping people on their path to better health.
Let me go through kind of like the best practices we saw, but I think we kind of like touched a bit, right? You know, but if someone has a specific comment, like you can see here, like kind of what we learned along. And Shante talked about this thing that we also tweak the message every time we did an episode. We learned something new, right? So these are kind of like the best practice. If someone wants to comment on this, we talk about, you know, the coordination with marketing. We talked about, you know, the brainstorming conversation.
I would add one additional thing, using our internal resources. So at CVS Health, we have advisors that are support our resource group. And so Kara Savoda is one of our advisors. She helped connect us along with our executive sponsors with the right individuals within our organization to help put it together. So if you are not a marketing expert, or if you aren't skilled in this, finding the internal resources to help polish, you know, finish those things off. So working collectively, but making sure that you pull in all of the areas and support that is needed to make it polished, to make it perfect. Finding the right panelists, finding someone to record it and edit it, bringing in legal, knowing what you don't know. So having someone internally to have that perspective, who isn't maybe part of the group, was helpful for us.
Yeah, well, it's true. So why don't we wrap in the last 5 minutes for, you know, best for last, you know, what's next, what's happening? Christian, Melissa, do you want to walk us through?
Sure. So I'll say this, when we started out, we said, we're gonna do 4. So we've done 3 so far. And the 4th one is, as I mentioned way in the beginning, is slated for January, where we're taking a step back and looking big picture and looking at what's ahead for LGBT group health equity. And what we're looking at is that framework between the partnership between corporations, the community, and government, and what that means in terms of how to leverage that partnership to advance health equity further in our community. And so, Melissa, you want to talk about who and how we got there a little bit?
Yes. Assistant Secretary Deborah Levine.
Rachel Levine.
Or Rachel Levine, sorry. Deborah Levine, someone else I know. From Health and Human Services within the Biden administration. And Accenture's government affairs organization helped to bridge that gap. We are very excited about the potential of working with her. And likewise, you saw it on previous slides, we've been able to secure very senior executives from Accenture as well as CVS Health to be able to participate in that conversation. So we'll take it up at a skyscraper level for some real tried and true thought leadership of how do we interact with each other and what are some of the next steps in this arena for health equity. And by the way, for Assistant Secretary Levine, health equity is one of the things on her agenda. So again, we're finding the areas that align with people's objectives and will add great return on investment. I would also add for season 2, we're looking at having a co-branded microsite between our 2 companies, continuing to build out those additional assets. So how can we integrate further to move the bar further for LGBTQ health equity? I think the thing, and I know we are about at time, and I think we can go a few minutes over to answer any final questions, but the other thing that I would say to close is actually a challenge to everyone on this call. As we looked at the people who had signed up and RSVP'd to attend this, we had people that we saw in the housing industry, in government, technology, food and beverage, finance, all kinds of different industries. We're all here at this conference because we see challenges in the LGBTQ community in workplace and in broader spaces. And so I guess our challenge to you is to think about where does your industry and organization intersect with the LGBTQ community, and with which suppliers and clients do you see some systemic relationships, and which ones have core competencies and intersections that could complement yours if you're interested in pursuing this kind of endeavor. And we certainly could use the help all across the board in every facet of our lives. So appreciate it so much, your time. And Shante, we'll pass it over to you to proctor any final questions and answers.
So there were a couple of questions around time commitment. So if someone is looking to put together something similar, what's a good time span? How long would we say that it took to plan, or it would take to plan a good, well-researched event?
Good question. So I think there's two ways to answer that. First, it's the right people, getting the right people on the team.
Right.
So make sure you have a marketing person. Make sure you have leaders in your pride or other ERG that's relevant to what you want to do. And that's your core team. Plus, we had some younger members that joined that really help along as well with the logistics. And then we committed to, and we kept it. We committed to once a week meetings for an hour. But then when you get into like the actual production of it and planning of it, the time does get intense, especially with the creating of the show flow and the messaging and the production end of things. You have to plan some time, as you would for any other producing a live event, is I guess the advice I'd give. But we were very good as well about delegating amongst ourselves and raising hands so that everyone had a specialty area to focus on. And Andrea in the beginning does for us all he orchestrates the brainstorming sessions, which is a very understated way of saying that there's a method to the madness that he does around how that we get to the results we get to. Melissa does a lot of the show flow content and how that gets prepared and manages that. Shante helps out with the speakers and the ERGs and the general kind of tone and tenor of what we're aiming at for. And I take on the marketing and messaging and do a lot of the content writing. I hope that's part of an answer. Someone else want to add to that?
I totally agree with that. You're right.
Yeah, I'll add one piece of advice. When you're first starting out, I think it took us about 6 months to do the first one. You'll speed up after that because now we're in a cadence of about every 3 months we're able to cycle through.
Correct.
So take some more time at the beginning when you're first starting off.
And I would just state again the importance of marketing, because it's wonderful to gather all these people together, put this together, but if no one sees it, it's that whole, if you chop down a tree in the forest and no one's there, does it make a sound? You want all of that to be heard and heard by those areas that you're trying to reach. So ensuring that there is a plan that goes beyond just the event, the filming, or what have you.
Yeah, so the marketing element of that is super important. The marketing that needs to be marketing person at the CVS side or the one side and our side at Accenture. And even more important is having the communications side. There's communications specialists. In our case, Danielle Pinto, a star, Suzanne Bianco, a star, that really orchestrate the communications plan that helped get us the architecture to get out internally and externally. And then on the CVS side, there was a marketing person, Nico, our friend Nico, who was really instrumental in pulling together the overall plan and then the social media aspect in particular. So we divided and conquered, and marketing is a key part of this for sure.
There's an interesting question in the chat around what are the lessons learned you would share that others could avoid in this type of work? So mine would be backup option for speakers, right? I mean, I think that it took a while for us to figure out what was the best way to recruit and identify and recruit speakers. And, so this one plus planning, planning in advance, a lot of, backup time. These people are busy. And you want to talk to those busy people. Otherwise, if you don't, the message will not be that powerful. That would be my kind of key lessons. Melissa, Shante, Kristen?
I would say avoid working in a void. There are things that we didn't think of initially, legal sign off, all of those things. So making sure that you are sharing with leaders what you are doing so that there is someone that can say, oh, this needs to be done. So again, finding what you want to do and then including others around you so that you don't have any stopping points right when you are ready to air or share the information.
Yeah.
I would add that after you start getting a rhythm, start utilizing the project plan previously to as a baseline for the next session. It helps make things cleaner, and that's something that I think we're admittedly still getting into at this point.
And the last is, I guess this is more result, but I think this is a good way to answer that as well, which is that cumulatively, if you're doing a program like this, if you take a step back and look like we are right now, it's impressive in terms of the assets that have been created. And so, as Melissa alluded to, when we're talking about the January session, with Assistant Secretary Rachel Levine and our respective leadership from CVS and Accenture, our government relations team at Accenture saw what we did and was like, wow, and sent out a communication to the Hill and to the White House that we all agreed on, along with the CVS media government relations team, and in presenting these assets, saying, here, we developed this to help with these topics. And that's where we got the response back from Rachel Levine's office. And so I think that cumulatively, when we do these and produce these well and think it through from thought to content to execution, you get to a result which has a way bigger impact. None of us would have predicted this a year ago.
Folks, I think like in a few minutes, the session will end. So, if there is any other questions, you know our names, how to find us, feel free to shoot a message. And thanks for the 200 plus people joined today. And also the other one, more than 170, they're still with us, right? So, any other message, Melissa, Shanta, Christian, we want to kind of leave this audience with?
Don't be afraid to work with other ERGs, CRGs, BRGs,
Yes.
whatever they are. All of our organizations are doing phenomenal work, but working with others, networking is a wonderful thing.
Well said. Thank you so much, everyone, for joining us. Have a wonderful rest of the conference and day, and feel free to reach out to us at any time. Good luck.
Thank you.
Thank you.
Bye-bye.
Thank you.
Take care.